Blood pressure 140/60ths, what the numbers really mean. The blood pressure is one of the most important indicators of cardiovascular health. It measures the force exerted by blood flowing through artery walls. This is something we hear a lot about heart health, but it's not always easy to understand what these numbers mean or what various combinations of high and low blood pressure readings might indicate. For example, a blood pressure reading of 140/60ths in which systolic pressure is elevated but diastolic pressure is abnormally low is cause for concern. These readings can reveal underlying health conditions that need further exploration. What is blood pressure? Blood pressure is the force of blood circulating through the walls of arteries, carrying oxygen and nutrients to various parts of the body. The heart acts like a pump, pushing blood into the arteries with each heartbeat, creating a measurable amount of pressure. Two key numbers in a blood pressure reading, systolic and diastolic, can give you insight into different aspects of your heart and blood vessel function. Systolic blood pressure, top number, measures the pressure in the arteries when the heart contracts and pushes blood throughout the body. This is the peak pressure in the artery and is usually the higher of the two numbers. Diastolic blood pressure, bottom number, measures the pressure in the arteries when the heart rests between beats. It represents the lowest pressure in the arteries and gives you insight into the workings of the vascular system during the resting phase of the heart. The importance of understanding these numbers becomes clearer when you know that each ingredient affects different aspects of your health. Generally speaking, healthy blood pressure readings for adults are considered to be around 120/80ths of a millimeter of mercury. Changes in this number may indicate a health problem, especially if the numbers are disproportionate, as is the case with 140/60ths. Both systolic and diastolic blood pressure are important because they measure the pressure in the heart and arteries during different phases of the heartbeat. Systolic blood pressure. This number increases as the force of blood against the artery walls increases during heart contractions. When systolic blood pressure is consistently high, it may be a sign that your heart is working too hard, which can lead to heart disease, stroke, and other cardiovascular problems. Increased systolic blood pressure is more common in older people due to arteriosclerosis, especially in isolated cases, without a corresponding increase in diastolic blood pressure. Diastolic blood pressure. This number is generally more stable but equally important. Low diastolic blood pressure means your arteries relax between heartbeats, but if your diastolic blood pressure drops too low, it may indicate a problem with the blood circulation in your body. Low diastolic blood pressure is particularly worrisome in younger people and can lead to insufficient blood flow to vital organs. A blood pressure reading of 140/60ths may be confusing at first glance. Higher systolic blood pressure usually indicates higher blood pressure, while diastolic blood pressure is abnormally low, resulting in a wider pulse pressure, the difference between the two numbers. This combination of high systolic and low diastolic blood pressure may be caused by a variety of factors. Isolated systolic hypertension. This condition is characterized by elevated systolic blood pressure, above 130 mm of mercury, but normal or low diastolic blood pressure, below 80 mm of mercury. This condition is more common in people over 60 years old due to age-related hardening of the arteries. Stiff arteries require more force to push blood through, resulting in higher systolic blood pressure readings. At the same time, the relaxed state of arteries between heartbeats causes diastolic blood pressure to decrease. Isolated systolic hypertension is a major risk factor for heart disease and stroke. Arteriosclerosis reduces the elasticity of artery walls. This means that when the heart pumps blood, the arteries cannot easily dilate to accommodate the increased pressure, causing systolic blood pressure to rise. When the heart relaxes between beats, the lack of elasticity also means diastolic blood pressure may drop more than usual. Aortic regurgitation. This is a heart valve disease in which the aortic valve, which regulates blood flow from the heart to the aorta, does not close properly. As a result, blood is pumped out and leaks back into the heart, causing systolic blood pressure to rise and diastolic blood pressure to fall. The condition can cause symptoms such as fatigue, shortness of breath, and heart palpitations, and in severe cases, can lead to heart failure if left untreated. Hyperthyroidism. Hyperthyroidism can lead to various cardiovascular problems, including increased systolic blood pressure and decreased diastolic blood pressure. Thyroid hormones can increase heart rate and increase the force of each heartbeat, causing systolic blood pressure to rise. At the same time, these hormones cause blood vessels to relax and lower diastolic blood pressure. Heart valve disease. Heart valve problems, such as aortic stenosis or mitral regurgitation, can interfere with the heart's normal blood flow, causing abnormal blood pressure readings. For example, aortic valve disease causes systolic blood pressure to increase and diastolic blood pressure to decrease, producing a wider pulse pressure. Dehydration. Severe dehydration can cause a decrease in blood volume, which affects the pressure the blood exerts on the walls of the arteries. In some cases, dehydration may cause systolic blood pressure to remain elevated due to the body's compensatory mechanisms, while diastolic blood pressure decreases due to a reduction in total blood volume. Medication side effects. Certain medications, especially those used to treat high blood pressure or heart disease, may cause changes in systolic and diastolic blood pressure. For example, certain medications may lower diastolic blood pressure more than systolic blood pressure, causing pulse pressure to widen.